Hello, I'm Dr. Sugar, your internet doctor, here to continue our discussion on migraine headaches. I will go into a lot more detail on what some of the tests for migraines are, what the prognosis is, and what can be done to prevent migraines. So if you're ready, let's get started with a dose of medical inspiration. So you have a bad headache and maybe some nausea or vomiting, and the light is really making the pain worse, and you really wish that everyone would just be quiet and let you alone so you could lie down in your dark bedroom for a while. Now maybe this has happened to you a few times now, so you go in to see your doctor. Physicians will usually diagnose migraine headache based on a few things. First of all, they will do a complete history of your symptoms, and then they'll ask you about a family history of migraines. And finally, they're going to want to know what kind of response you've had to previous treatments. I really find it very helpful when my patients arrive with a headache diary in hand. You say, a headache diary? What the heck is that? Well, a headache diary can be as simple as taking the calendar off your wall and write a few things on it. Or you can even go to the internet and download one of those fancy headache diaries from many different sites on the internet. What you want to do is keep track of a few things on the diary or the calendar. For example, keep track of your menstrual cycle on the calendar, and not just the first day. Any day that you're having menstruation, you want to mark that on the calendar. Also, make note of any headaches, and notice if you have had any preceding symptoms or auras, or if there were any unusual symptoms to your headache like loss of balance, slurred speech, or any strange sensations in your body. Notice also if you had any mental or physical changes. And then, on a scale of 1 to 10, decide how severe the headache is, and then, if you can, describe the pain. Where is it? And are there any associated symptoms like vomiting or sensitivity to light? Then make a note of what time did the headache start, and what were you doing when it started? And finally, how long did that headache last? It is also a good idea to keep track of what treatments you use for the headache and how those worked for you. Then if you look back on anything unusual in your life at that time, for example, increased stress or decreased sleep, or I went to a wine and cheese party, also make note of everything that you ate or drank in the 24 hours preceding the migraine. Now this may sound like a lot of work and a lot of things to keep track of, but it's going to pay off because this is going to be so helpful to you in identifying your particular triggers. So take the time to keep this headache diary, and be sure to take it with you to your doctor's appointment, because this will be so helpful to your doctor to be able to efficiently see how these migraines are affecting you and affecting your life. Usually a detailed history will help differentiate between tension headaches, sinus inflammation, or a more serious underlying brain disorder. Now sometimes an MRI or CT scan of the brain is obtained to rule out other causes of headache like sinus inflammation or a brain mass. In the case of a complicated migraine, an EEG or an electroencephalogram may be needed to exclude seizures. Rarely a lumbar puncture or a spinal tap might be performed, and this is to rule out signs of infection. So if you have migraine headaches, what's the prognosis? There are many, many treatment options available, and each person responds differently to them. Treatment is and can be optimized by maintaining a personal record to keep track of response and communicating this closely with the physician. So that diary that I told you about is a good idea. There are always new drugs on the market, and finding the one that works for you will not be hard. So what about prevention? Migraines may be prevented when your triggers are identified and avoided. I don't mean to harp on you, but that diary is really going to help in this arena as well. To pinpoint your migraine triggers, remember that headache diary that we talked about is going to be very helpful to you. Talk with your doctor about what sets off your headaches to help find the right treatments for you. If you're having frequent and severe migraines, there are a number of different medications that can be used on a daily basis to try and prevent those migraines, or at the very least decrease the severity and frequency of the migraines. I'm Dr. Sugar, and be sure to watch part 4 of our series on migraine headaches. In the next section, I will go into a lot more detail on what the traditional as well as the alternative treatments for migraines are. So make sure to watch it, and I'll see you there.